Funding for the Maddy Report is made possible by grants from the California Emerging Technology Fund, leaders in the quest for digital equity. The James Irvine Foundation, committed to a California where all low-income workers have the power to advance economically. Fresno State Associated Students, Inc., students serving students. BNSF Railway, moving our economy for 160 years. And The Wonderful Company. The Maddy Report is also made possible thanks to contributions from Harris Ranch Inn and Restaurant and E&J Gallo Winery. From the Maddy Institute, the Public Policy Institute for the Valley's 4 public universities, this is the Maddy Report with Executive Director of the Maddy Institute, Mark Keppler.
Welcome. Access to safe drinking water would seem to be a pretty basic expectation. Recently, the non-partisan Legislative Analyst Office authored a report that noted, quote, despite federal and state water quality standards, over 1 million Californians currently lack access to safe drinking water. In addition, the report noted some Californians struggle to afford access to safe drinking water, sometimes paying in excess of 5% of their income on their water bills, unquote. The author of that report is our guest, Rachel Ehlers with the Legislative Analyst Office. Welcome to the Maddy Report.
Thank you so much for having me.
Good to see you again. So listen, I'm going to ask you, let's start from the beginning. How do most Californians receive their water?
Yeah, so our drinking water comes from either surface water like rivers or pumped from underground, groundwater. And the vast majority of Californians get that water through treatment and delivery systems that are run by local governments or private utilities. But there's a smaller percentage of Californians that get their water from much smaller water delivery systems that either have, fewer than 100 connections from the source to piping to directly to the house, or in some cases even 15 connections or fewer. And then there's maybe somewhere between 1.5 million, 2.5 million Californians that get their water directly from domestic wells in their backyard, where the water is treated right there and serves the house.
Yeah, and we'll talk about some of that in a moment. But what about the laws governing water quality? Can you explain some of those?
Yeah, so we have the Federal Safe Drinking Water Act, which sets standards based on the health risks and treatability of various pollutants for kind of the degree of that contaminant that can be in drinking water. And the federal government delegates authority to the state of California to regulate and enforce those laws. And then the state has also enacted some drinking water standards that in some cases are more stringent than the federal laws for monitoring the pollutants in water. And the state monitors and regulates for water systems. But I have to say that the level of oversight and monitoring is not the same across all systems. Those smaller systems have a much lower level of monitoring and standards. And those that have 15 or fewer connections are monitored by county health departments and not by state, and much less robust testing and oversight. And then domestic wells are not regularly monitored at all from the state or the county.
Yeah, a big difference in whether or not they're monitored. So in your report, you state that, quote, many Californians lack access to safe and affordable drinking water. Can you expound on that, safe and affordable drinking water? What does that mean?
Yeah, so as you said in your opening, the estimates are that over 1 million Californians get their water from systems that don't meet those standards. So that means that they may have contaminants in them like arsenic or nitrates that could cause health risks. There was research conducted in 2019 that suggested only in 17 out of our 58 counties do all public water systems meet those standards. And there are 12 counties where they estimate that more than 10% of residents have unsafe tap water, including Kern and San Joaquin counties here in the Valley. So there's water contamination issues. There are also some wells that are dry now. We saw a lot of that happen during the last drought as groundwater levels dropped from not enough rain and also from more intensive agricultural pumping. The groundwaters dropped, the wells went dry, and many have not been restored. And then, as you mentioned, affordability is also an issue. The price of water services has gone up significantly in recent years. The average household paid 45% more for drinking water in 2015 compared to 2007, and not all incomes have increased at that same level. So that really
I think I said you read your report was very detailed, and it said that something like there's only been a 9% decrease actually in income for the bottom quartile of Californians. Their actual income has actually gone down while the cost for water has gone up.
That's right. When you adjust for inflation, that's right.
Yeah, that's really, really problematic. And then with your note of, I did quick math on the 17 out of 58 counties that had public water systems that comply. That's less than 30%. So
Right.
that should tell folks something. Let me ask you this. You note in your report that the accounting of drinking water problems and the costs are actually unknown. So when we're talking about roughly $900 million to fix the problem, that's really an incomplete number. So is anyone trying to get a handle on the scope of the problem?
Yeah, I mean, the issue is always you don't know what you don't know. And so we do have an estimate. The state has developed an estimate of $900 million to address systems we know are out of compliance. But as I mentioned, we don't collect data or monitor the very small systems with fewer than 15 connections or domestic wells. And we think that that's likely where a lot of the water quality problems are. We just don't know the magnitude. So the good news is we are trying to get some additional information. The state is undertaking a comprehensive needs assessment that hopefully should be completed this summer. That's going to look at, are there systems that are at risk of failing to comply? What about those very small systems and domestic wells? Are they either at risk or potentially not complying with standards now? And then also trying to develop a sense of what the associated costs are so we kind of understand the magnitude of the problem.
We only have a few seconds left in this segment, but I just want to get out quickly. Where and who are most impacted by this problem?
In a nutshell, it's statewide, but concentrated in the Central Valley and lower income communities, and Latino residents are disproportionately affected compared to other racial and ethnic groups.
Okay. Well, up next, we're going to talk about some past attempts to deal with this problem. That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. Recently, the non-partisan Legislative Analyst Office issued a report about the lack of access to safe drinking water and the challenges faced by 1 million Californians to afford access to that safe drinking water. We're talking with the author of that report, Rachel Ehlers. So Rachel, it's not like safe drinking water is a new problem. This has been around for some time. What's the state done in the past to address this problem?
Yeah, the state's taken a number of actions over the past decade or so. One of the most significant was in 2012 when the legislature passed kind of first in the nation legislation stating that access to safe and affordable drinking water is a human right. Although that legislation didn't expand the obligation of the state to provide water. So in some ways it was just a statement of intent. But during the drought in 2015 and 2016, the state expanded the authority of state agencies to intervene when systems consistently fail to provide safe drinking water. So this is things like being able to appoint an administrator to take over a system, and ultimately even able to require consolidation of systems if there are consistent failures. And there's also been quite a bit of funding from voter authorized bonds, Proposition 1 in 2014 and Proposition 68 in 2018 that provided kind of roughly $1 billion to address drinking water issues. There's some federal funding, roughly $90 million a year, and there's been some general fund provided as well. But all of that funding is really primarily for capital projects, for kind of big one-time efforts rather than ongoing efforts.
Yeah, despite all these efforts, in 2019, the state actually created a new drinking water fund and program. Generally, what are the stated goals for that new program?
Yeah, this was pretty significant legislation in 2018, SB 200, it's referred to. I mean, ultimately, the goal of this legislation and new funding is to help provide adequate and affordable, safe drinking water for every Californian. It's a pretty simple but ambitious goal. Obviously not going to be accomplished overnight. So there's some sort of interim activities that the legislation and the program intend to pursue, like providing emergency drinking water supplies, for example, to really address the problem immediately, with the longer term goals of developing sustainability for these systems so that they can continue to address the needs. The legislation is really intended to be responsive to problems that we identify, but also proactive to kind of identify, are there systems at risk, so we can address them before the problems occur.
Yeah, so the way they set this thing up is they have a new funding and new administration. The funding was $130 million, but kind of unique where it comes from. Can you explain a little bit about the funding and the administration?
Yeah, so it's $130 million annually. So that's a difference from some of those other fundings in that this is ongoing, at least for 10 years. It's through 2029-30. It's funded by the state's Greenhouse Gas Reduction Fund, which are auction revenues from our cap and trade auction program. And these funds are pretty unique in that they are not just limited for capital projects. In fact, they're intended not to be primarily used for construction. It's really to fill in gaps with those other funding sources. So things like technical assistance to water systems, or providing emergency drinking water supplies, helping consolidate, even ongoing operations and maintenance in some cases for some of these systems. So really as a supplement. It's administered by the State Water Resources Control Board, and that board sets the priorities and is responsible for picking the projects and how to spend the funds.
Yeah, the state seems to be getting more involved. You think like with groundwater and just the whole issue. The state seems to be becoming more involved with water issues, and safe drinking is just another example. Well, up next, when we come back, how is the state using that $130 million to address the issue of ensuring a safe and affordable supply of drinking water? That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. We're talking with Rachel Ehlers, an expert in water issues with the non-partisan Legislative Analyst Office, about the state's $130 million fund to ensure safe and affordable drinking water, problems that affect nearly 1 million Californians who are disproportionately Latino and live in rural and lower income communities, many of those in the San Joaquin Valley. So Rachel, the state is required to develop an annual expenditure plan for that $130 million. What are the priorities in the current plan?
Yeah, so the State Water Resources Control Board that administers the fund and program set up 4 priorities for this current year that we're in the middle of right now for expending those funds. First is addressing the urgent and immediate needs that are identified right now. Second is to address systems that we know are out of compliance with state and federal water standards, with a focus on lower income communities. The third is to take actions to accelerate consolidations of some of those smaller systems so that they can gain economies of scale and work together. Again, focusing on lower income communities. And then finally, starting to address some of those very small systems and domestic wells that we think are out of compliance, or we have some initial data suggesting that they are. So really starting to tackle the information we know about so far now.
Yeah, it's interesting. I had noticed that while the fund is supposed to be prioritized in using it for other than capital construction projects, construction is the largest proposed spending category this coming year, with up to 38% of the fund monies. Sounds like a contradiction.
Yeah, it's true that these funds are intended to fill in gaps, however, and while that often the gaps are in non-construction activities, the fact is that when projects apply for some of those other funding sources like bonds or federal funds, there's often a maximum grant amount for the amount that they can get. And if it's not enough to complete the project, they can sometimes end up sort of stranded, waiting to try and find money to be able to complete the project. So I think the state's using this funding again to fill in those gaps and try and get some of these projects really across the finish line.
Yeah, that's a good way to describe it, I guess, filling in the gaps. You know, another item when I was looking at this that stood out to me was the money spent on technical assistance. You know, in the previous year, over half of the fund expenditures were used for technical assistance, but this upcoming year, that was cut in half. Kind of surprised me. Why the drop off in technical assistance? Are these local water systems becoming more, technically competent?
Yeah, I mean, I think certainly there's going to be a continued need for technical assistance throughout the length of the program. I think part of the explanation is that the state staff really beefed up some in this year, got additional funding to hire state staff. So I think now the state might be able to provide some direct services to some of those local agencies rather than, giving them funding and telling them to go figure it out, actually being able to do things like legal services for some of the system consolidations, or do some of the planning or some of the public outreach for them. So really an increase in state capacity to help at the local level.
Yeah, and that's economies of scale too, right? I mean, having one place to go to as opposed to every single local jurisdiction trying to do it themselves, it just seems to make more efficient, right? And some of these smaller systems, you have a problem with having all that technical expertise. It's expensive,
right? Especially if you think about a small system that only serves fewer than 15 houses. It really is a very small enterprise.
Yeah. So, and notice that there's been a shift, it seems like, over the years from public water systems that are failing to those systems that are at risk of failing, and also smaller systems and domestic wells that are high risk of being contaminated with our aquifer. How big a shift are we seeing here, and why are we seeing it?
Yeah, well, across the 2 years that the program has been operating thus far, as you mentioned, in 2019-20, about 70% of the funds were spent on systems that are out of compliance, compared to an estimate of, or a target estimate of only 40% of the money for 2021. So part of that, I think, is just a balancing of priorities. We want to address the known problems, but also get ahead of some problems that maybe are on the horizon but haven't been identified yet. That makes them less costly, less disruptive. If we know a system is teetering with compliance, let's address it before they fall out of compliance. But I think also, as I mentioned, we don't have a lot of data about these very small systems and domestic wells. So they probably haven't been flagged as being out of compliance yet, when we may know that their water isn't meeting standards. So some of it reflects, again, trying to get ahead even before the compliance system has flagged them to address the problem.
It's, what is that, the old commercial, pay me now or pay me later. It's better to be ahead of the curve before these things become out of compliance than when they're already out of compliance. Let me ask you this. As we've discussed, in addition to access to safe drinking water, the fund also focuses on the affordability of safe drinking water. What's being done in that regard?
I think the main way this program is trying to address affordability is just to make the systems operate better, to consolidate and address issues which will bring down costs for ratepayers as there are economies of scales developed. There are also some actions like the board, if it's a economically disadvantaged community applying for the funds, they can get funding as a grant rather than a loan, so they won't have to repay. So that can affect some of the obviously ratepayer costs as well. But outside of this program, the state's also undertaking some other efforts. You know, with water, we don't have the same kind of rate assistance programs that we do for like electricity, for example, for lower income households. So the state's doing some exploring about if there are ways that we can expand those types of programs to address affordability concerns.
Okay, well, up next, we're going to talk about whether the state is actually delivering on the promise of safe and affordable drinking water. That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. The governor and the legislature have made it a goal to provide safe and affordable drinking water that is currently unavailable to almost 1 million Californians. Are they meeting that goal? We're talking with Rachel Ehlers with the non-partisan Legislative Analyst Office, who's reviewed the state's efforts and drawn some conclusions. So, Rachel, first off, what are the performance metrics that the state has set for itself?
Yeah, the State Water Resources Control Board that's administering this program has set up a series of performance metrics where they're going to set annual goals and collect information, things like how many communities came into compliance with the drinking water standards, and also some internal administrative, are they meeting administrative timelines for turning around applications, that sort of thing. Because they're just getting started, they don't have data or goals for most of them, but we think it's a good sign that they're setting up those accountability metrics.
You know, it kind of leads us to the, I don't know if I say the $130 million annual question or $900 million question or plus, whatever. The big question is, so what is the Legislative Analyst Office assessment of the implementation so far?
Yeah, so far, I would say we think so far so good, but very early. That's it in a nutshell. I mean, the department has hit its statutory deadlines, even with the complications of COVID. Adopted spending priorities we think are reasonable and consistent with the legislation. They're selecting projects, expending funding, collecting data. So it's all where we would hope that they would be, but also really where we would expect they would be at this point.
Yeah, so despite your overall good review, however, typically cautious LAO says, listen, we still need legislative oversight on this issue. What are some of the key oversight questions you think the legislature should be focusing on?
Yeah, I mean, given this is such a high priority for the state and it's so early in the implementation, we think careful legislative oversight is really important. First is how well the program is meeting its objectives based on those performance metrics and also the intent of the legislation. But also looking at whether the legislature might need some additional information beyond those performance metrics to assess performance. Things like, you know, the department is planning to report on how many communities received services, well, how about how many households and people got safe drinking water? That's the ultimate goal. So there may be some additional information. Also, as we talked about earlier, the Latino communities have been disproportionately impacted by problems with accessing safe drinking water. So that's an area the legislature may want to focus on really explicitly and collect additional data to ensure that we're starting to address those disproportionate impacts. And then funding, of course, is something we always want to keep an eye on, particularly for a program like this where we've set out a plan of spending $130 million a year, but we don't really know what the magnitude of the problem is yet as we're still collecting data. So once we get the results of that big needs assessment across the state, doing some work to look at how well does the available funding align with the available need, and do we need less money? Do we need more money as the years go by?
You also note in your report there's some emerging issues that may complicate the state's effort in this regard. What are some examples of that?
Yeah, there are three really big key issues that we think could exacerbate the conditions that this program is trying to address. So the first is groundwater pumping. As we know, during the drought, many domestic wells went dry from groundwater pumping. So that's something we got to keep an eye on. The state adopted the Sustainable Groundwater Management Act, or SGMA, that's trying to help regulate groundwater. But how are those two big pieces of legislation and big state priorities interacting? Our efforts on drinking water and our efforts on groundwater regulation? And are we ensuring that the problem isn't getting worse as we're trying to address it? Which leads to the second big issue of drought, which we see on the horizon. We've had a couple of really low precipitation years. How will that affect groundwater levels and domestic wells? And then third, of course, is the COVID pandemic. We can't avoid talking about that. We right now have a statewide moratorium on shutting off water for households that aren't paying their bills, but there's been data collected that suggests that 12% of California households are behind on their bills. That's 1.6 million people, and debt totaling $1 billion statewide as of January. So what happens when that moratorium ends? How will that affect some of these vulnerable households, as well as the small systems that aren't getting that revenue that they need to operate? So the recent federal stimulus package that passed has some funding that could be used to help mitigate that, but this is something that certainly we think the state's also going to be confronted with in the coming months.
Yeah, I think you make some really good points. You think this thing is settled, but there are things in the horizon, like drought. I mean, that is going to be something that's probably going to be with us. The groundwater situation with SGMA, I mean, they may have completely different goals in terms of what they're trying to accomplish and what the safe and affordable drinking water goal is trying to accomplish. So lots of big things in the horizon. So what's your wrap up final conclusion?
I think the big takeaway is so far so good, but still really early. And this is just such an important priority for our state and for our residents. So, continued oversight and engagement by the legislature, but also the public is really going to be important to make sure
hopefully we'll stay engaged. You've given us some great information. Thank you very much, Rachel Ehlers from the Legislative Analyst Office. And thank you for joining us. This is Mark Keppler for the Maddy Report. If you want to stay up to date on state and local politics, you can sign up for our free e-newsletter, the Maddy Daily, by logging on to our website at maddyinstitute.org.